Scorch. This is a pretty serious disease that is spreading rapidly throughout the country. And these are the outcomes that I would like everyone to obtain from this presentation. Learning basically how to identify it, how it's spread, how do we control it, and also knowing right off the bat that it cannot be cured. We can only treat and mask the symptoms of this disease. We're going to be seeing this slide several times through this presentation, and we're going to learn a little bit about the background, just a brief history of BLS and how to diagnose it, how to control it, and then also how to integrate this into your planned healthcare business if you do have one. So we're talking about bacterial leaf scorch. This basically affects probably over 30 different families of plants. It has a wide host range. Most of the research that was done with some of the treatments were done primarily on oaks and maples, and they seem to be the ones that suffer the most, in particular pin oaks. They can cause considerable damage to the urban forest. And the reason I mention the urban forest is because that's where trees all are struggling to begin with in the urban forest. Limited root zones. They also go through a lot of soil compaction issues, drought stress, and those conditions exacerbate the symptoms of bacterial leaf scorch. So I just want to mention again, this is not the silver bullet. We are not going to cure this problem. We're going to suppress it through treatments. And so we're going to just minimize the symptoms and provide an aesthetically better looking tree for the client. So here is a electron microscope photograph of the actual bacteria. What these bacteria do, this is Xylem fastidiosa, and they inhabit the xylem. And we all know that the xylem is the water conducting system of a tree, of a plant, and that results in a clogged vascular system, and that results in a desiccation of the leaf. Over years, several years, if not treated, this can lead to an early death of the tree. This bacteria will feed on the nutrients in the xylem and will also multiply within the xylem as well. This is sort of an interesting photograph. This is the actual the bacteria in the xylem, and you can see how they multiply and they're clogging the vascular system, resulting in a tree that gives this scorched appearance, and it's appropriately named. It's a bacteria. It affects the foliage. Eventually it affects the foliage, and it gives the foliage a scorched appearance as if someone lit them on fire. Here's just a brief history of BLS. I'm not going to spend too much time on this, but it was observed basically in the 1800s on grapevines. And originally they thought it was a virus, but now they have finally discovered that it is a bacteria. And so today there's still research going on. Rainbow is partnering with Bartlett tree experts this spring on doing some experimental trials with some new products to see if we can improve the efficacy of the treatments and get a little bit better results. The range of BLS, as you can see, is spreading rapidly. About 20 years ago, it was not in New Jersey, where I'm located right now. So since then, it's moved up, and it's gradually moving north. And how is it moving? It's moving through insects. Insects that are feeding on the xylem, that are sucking out sap. And what they're doing is they're moving from an infected tree to an uninfected host tree, spreading the bacteria in that fashion. Certain plants are also susceptible to this bacteria, but it's not showing very many symptoms. They don't show the symptoms as certain trees like the oaks and the maples and what have you. So this is what we're going to begin talking about, the symptoms. It's very important that you diagnose this properly, because oftentimes there's other problems that could be affecting oaks or maples that are very closely related. One thing you'll see that the symptoms will reoccur year after year on the same branches, and eventually through the spread of this disease, the whole tree eventually will be infected. What happens is the trees, they lose their vigor with foliage that has been compromised They'll no longer produce the sugars and starches that they're designed to produce. Fertilization and mineral applications, they are not technically feeding the tree. The tree is feeding itself by going through photosynthesis and producing the sugars and the starches that the tree needs to support the growth. It's very difficult to diagnose it, as sometimes symptoms vary from tree to tree species, but one of the only way really to properly identify it is to take a sample, and you can send it off to the University of Minnesota Plant Disease Clinic, and you will want to request an ELISA test. The reason I say that is because that test is a lot less expensive than a PRC test, which is more accurate. However, it's more time-consuming and more expensive. So how do we see this disease progressing? The picture in the lower right is a pin oak tree, and this usually the symptoms show up in late July through August, and that's because that's when the tree is going under the most stress, moisture stress, and also we're dealing with higher temperatures at that time. And what's interesting about this disease, next year the same tree will leaf out totally normal in the spring, and that will also sort of lull you in thinking that you no longer have a problem with this tree. But again, then in late July and August it goes back to the scorching look. And as you can see, here's a close-up of some of the foliage. It appears that the trees were lit on fire, and that's the very typical of this particular disease. So this is an early spring photograph of a bur oak on the left. You wouldn't know it, but that tree has had a history of having the bacterial leaf scorch. So these are the vectors. These are the insects that are feeding on the xylem, that are picking up the bacteria and then flying to an uninfected host tree and spreading the disease in that fashion. Oftentimes they'll feed on the petioles, and it takes a very short couple of days or so before that bacteria gets into the new host and starts to multiply and moves throughout the tree. So here's a little illustration. If you look up on top, here's the infected leafhopper, moves to the host tree. It begins to feed on the petioles. Immediately the xylem vessels become clogged and the bacteria grow within the xylem because they're feeding off of the nutrients that are in the xylem. And then it just progresses into further infection, and then the cycle just continues. One thing that you should understand is that you'll see this pin oak that's almost totally defoliated right now. The tree looks like it's on death's door, but it's not. It will recover next year. And so you'll see this tree just having very, very little foliage. Again, not able to produce enough sugars and starches for the tree. And over many years, sometimes 5, 10, 12 years, the tree will eventually decline and will eventually die. And here's an example of that. Even though the camera angle is not identical, but this is the same tree. This tree has not been treated, and you can see the progression over time leads to ultimate death of the tree. And obviously that tree is pretty much gone, in my opinion. I wouldn't do any treatments on trees that are rapidly declining. The treatment protocol is not based on that. It's on trees that have some percentage of survivability, but in my estimation, this tree on the right, it would be too far gone to do the complete three-pronged protocol and the remedial process. So looking at close-up, the bacterial leaf scorch symptoms begin at the margins. So on a red oak tree, they begin from the margins of the leaf, and they sort of occur in a regular pattern. And one of the key points to help in aiding in diagnosing this problem is notice the transition zone between the healthy green section of the leaf. You've got this yellow halo section, and then it leads to the totally brown necrotic area along the margins. And that's one of the good indicators of you've got this disease. Symptoms are going to be different in all different species. Again, like I mentioned, the trees, they come out normally in the spring. In the spring, the temperatures are cool, soil moisture levels are high, and so you really don't see the stress on the tree. It's when we move into the summertime where the soil moisture levels may drop, the bacteria has spread, clogging the xylem, and that's where you start to see the necrosis begin. And also look for that yellowish to reddish brown halo, and that's a really good indicator. Some of the symptoms, again, we mentioned it begins in mid to late summer. And also what happens is that the bacteria, as it's clogging the vascular system of the tree, it prompts a response, a defense response in the tree, very similar to Dutch elm disease, where the tree produces tyloses, and what it tries to do, it clogs its own vascular system and to block off some of these bacteria that are invaded the xylem. So in a way, the tree also causes its own decline. So if we have a drought stress situation with limited soil moisture, there's not much moisture in the soil to be taken up through the roots to get out to the leaves to prevent the desiccation of the tree. Here are some of the other factors that can cause this, and you can see that you have to accurately diagnose this because you could be going through more drought stress, and in this particular season with the extra use of road salt could also create similar symptoms. So there's two different agents, causal agents that can, categories of causal agents that can produce scorching systems. Some of these are having a limited root system, any type of damage to the root due to construction or soil compaction, drought stress, and also flooding. Ironically, flooding can cause very similar scorch symptoms, since flooding can cause roots to rot, and rotten roots will not be able to effectively take up moisture to replace the moisture lost through transpiration. The other causes are living causes, biotic, and they could be fungi, viruses, insects, and they could also create the same symptoms. So what do? We've got a tree, and so this is that slide we talked about. This is basically the overview slide. Now we're going to talk about how to manage this problem. And it's a three-pronged approach, as I mentioned. And also, again, there's no cure for this scorch. What we're trying to do is trying to extend the life of the tree through some cultural practices, and as well as some chemical treatments as well. So the first step is the pathogen suppression. There are products out there, OTC, that's going to suppress the growth of it, not eliminate it. And then we're going to also deal with the drought stress. We're going to work with the root system, make it as efficient as possible. And also we're going to reduce the spread of it by controlling the vectors. So Bacastat is the product. It is active ingredients oxytetracycline. It's a water soluble, so the application goes in quite quickly, and it's not solvent-based like some other OTC products. It goes in very rapidly. It's injected into the root flare of the tree, and it will it'll suppress the growth of the pathogen. It will not eliminate it, as we've already discussed. This is a treatment that has to be done on an annual basis. It provides no carryover from year to year. So again, that's something that you also have to consider. And so when the disease is just beginning in the tree, that would be an ideal time to start the treatments. If you come across the tree upon inspection, you notice that it has a lot of severe root damage. Maybe you've got some concealed cavities. You've got some structural problems with the tree. That may not be a good candidate for doing these treatments. These are some field results of some trials that were done back in Kentucky, probably about 10 years ago. And here's an example. These pin oak on the left, this is the same tree. Just prior to application in October 19th, it was rated to have 90% leaf scorch. And then exactly 1 year later, by a day, the tree was rated again after it was treated with Bacastat, and only 20% leaf scorch was evident. Here's another tree. Again, it was treated on October 19th, 75% rating, and then the following year, exactly 1 year later, this had a 50% scorch rating. So you can see just the treatment alone of the Bacastat worked quite well. Now compare that to trees that were not treated. Here's a tree that was rated 80% leaf scorch. The following year, it increased to 90%. So you can see the difference in doing nothing at all. Again, this pin oak on the left is 80%, and then the one on the right is 90%. So you can see how this tree is continuing to spiral and decline, and it's just a matter of time before that foliage can no longer produce enough sugars and starches to support that tree. Often what happens, the tree becomes weakened. Secondary pathogens like borers will come in and oftentimes take out these trees. How do we deal with the drought stress issue in the tree? Of course, we can get our watering can out and water the tree, but I think it's a little bit more than that. Mulching is very important, and we also want to improve the root system. There's a couple of ways of doing that. You want to mulch the root system. You want to apply mulch in 2 to 4 inch thicknesses and not on the root flare, because we all know that excess mulch on the root collar can cause some canker problems. There's another product that you can use as Cambistat, and that's a tree growth regulator. And what you're trying to do is, with using Cambistat, you're trying to develop the root system, and that's one of the benefits of Cambistat. It will help a tree increase this fibrous roots, and so by doing that treatment, you'll provide the tree with more roots to uptake moisture and distribute to the tree. At the same time, you'll be reducing the terminal growth of the tree, and you're just redirecting the tree's energy. There's another tool that you can also do to help trees that are struggling from bacterial leaf scorch is the air spade. The air spade was invented by the government to disclose landmines in the desert, and the arborists took this tool back in the late 90s, and they used it to decompact the soil using air. The other option would be to go in there with a ditch witch or do some vertical mulching with drilling, but what happens, with a ditch witch, you did cause a lot of root damage, and so you're really sort of defeating the whole purpose. The air spade decompacts the soil. At the same time, you want to incorporate organic matter into the soil, and that you're trying to increase the oxygen level into the soil. The other product that I mentioned is Cambistat. Cambistat can be used to also reduce the vegetative growth, but also you want to increase the root development to deal with the water stress. One thing you have to keep in mind with both Cambistat and Verdur, you have to evaluate the crown of the tree. If you notice that the crown is not represented properly by the diameter of the tree, you will also have to do some dosage reductions for both products. Here's an example of how Cambistat works. Here's the control on the left, and this is courtesy of Gary Watson at the Morton Arboretum. Cambistat creates a healthier root system, and when you have a healthy root system, you're going to be able to take up nutrients, and that will result in better and more quality growth of the tree. And here's an example. If you ever want to try Cambistat, I would say one of the most responsive species of trees are red oaks. Red oaks work really well with Cambistat, and Cambistat works really well with them. It creates a darker, greener leaf, more chlorophyll. Sometimes the leaves are slightly smaller than normal, but you're trying to reduce the terminal twig growth length to keep them nice and bushy and green. Here's an example of Cambistat being used on an infected tree. And this is courtesy of Bartlett Tree Experts, and you can see the difference. The exact tree 1 year later. It takes about 1 year for the true effect of Cambistat to show up, and it can last 2 to 3 years. Now, the third step would be reducing the vectors. The vectors, again, are feeding on the xylem. They're picking up the bacteria, and they're spreading it from the infected tree to the healthy tree. So if you've got a client, you've got a property, a golf course, condominium association that has a large stand of trees that are very susceptible, this is where managing the vectors might really come in handy. And how do we do that? Xytect, which is active ingredient in imidacloprid. This is very effective on all the vectors of the tree. Since xylem will be translocated, Xytect will be translocated up in the xylem, and that's where they're feeding. So they'll pick this up fairly quickly. And so what we'll do is we'll do either a soil injection or a soil drench, and we're not going to eliminate all the vectors, but we're going to suppress the distribution of the disease by controlling these vectors. So again, you want to combine this with the actual OTC, the Bacastat, the root revitalization, and also you want to use the insect control as well. Very easy to apply Cambistat and Xytect. They're applied identically, either with a basal drench. What you can do is do a root collar, pull the sod back, get to that root flare, make sure that you build a small moat around the base of the tree to prevent this product from moving away from the root flare. If you're coming on a slope, you'll have to make sure that you do an extra careful job of making that moat. Or the other more efficient way of doing it is with a soil injector. This is a motorized backpack unit, and this is our HTI soil injector. It injects doses from 0 to 250 milliliters, so it's very accurate, and it's designed basically for Cambistat and Xytect. We do not recommend any fertilizers go through this unit. It's a very precise piece of equipment that would be very sensitive to the salts in the fertilization. So how do we integrate this into your plant healthcare business? Rainbow, as you know, we have our own tree care operation in Minneapolis. We have 15 to 17 territory arborists out there every day working with homeowners and clients. We have developed quite an extensive marketing program on various pest problems, and we are more than happy to support you and help you with these marketing programs. We can actually take your company logo, imprint this on the back of this particular piece, and where you can in turn mail it out to your clients and to educate them and let them know that there are treatments for this particular problem. We also are willing to host seminars very similar to this. I've met with clients, arborists on a one-on-one basis, and I've gone out to the field and I've worked closely with their clients as well to come in as a technical support, and that's where I am. I'm a technical rep for this company. So again, these are where these marketing items can really be effective. Supposedly you've got golf courses and property managers, and they all respond very well to this. I just want to let you know that we have a technical support team, which I'm one of the members of. You can call us at any time. Well, not any time. We're there basically Central Time from 7 a.m. to 5 p.m. and where someone is usually available there to answer any of your questions, give you technical support, give you the science behind the products that we offer, protocols, and how to do the actual application. Also, we have the sell sheets, like I mentioned, and the science guides as well, and the business. We also can guide you on pricing and understanding all the different business models as well. So with that break, now we're going to move into Verdur and Chlorosis, and we're going to talk about how to diagnose interveinal chlorosis, which is fairly common and especially occurs in soils that have a tendency to be quite alkaline. The intended outcomes from this presentation are, we want to understand what are the causes of chlorosis and how well they respond to treatments. And again, very similar to the bacterial leaf scorch protocol, we want to improve the root system because chlorosis is not just created by a soil pH problem. It's basically a combination of the root system and plus nutrient levels in the soil and missing nutrients as well. And then also we're going to talk about how to perform the infusion process efficiently. So, okay, what is chlorosis? It's a condition where the trees are not getting enough manufacturing of chlorophyll, and they could be due to some of the deficiencies in the soil pH, and as we all know, the pH of the soil will tie up certain nutrients, making them unavailable to the tree, even though they're in sufficient quantities in the soil. We also want to talk about some of the differences between iron and manganese, since they are the most common deficiencies out there. So what we're going to do is first look at, this is an example of a tree that I did some trials on in State College, Pennsylvania. This is a pin oak tree, and this is the day that we did the treatment. You can see the interveinal chlorosis. The leaves look awful yellow, and the veins are quite green. And this is the same day that the tree has a scorched appearance. This is in early September a few years ago. And the two photos on the right, you can see that the pin oak has improved from after the treatment, and from a distance that tree looks fairly free of leaf scorch. So it takes about, sometimes you can see the difference in as little as 2 to 3 weeks after treatment with iron deficiencies, with manganese. It's going to take a whole growing season before we see that difference. So how do we do the diagnosis? This photo up in the upper left is a red maple that I took a photo of at Michigan State University, and that's manganese deficiency, very typical of manganese. And then this is the iron chlorosis on a pin oak at State College, Pennsylvania on the right. So what you'll see is the ones that are really affected, you'll see some terminal dieback, and also that weakening of the tree makes that tree more susceptible to other problems as well, especially borers. The other things that we're going to talk about is how they are difficult at times. There are diagnostic tests available out there to determine which deficiency you have, whether it be manganese or iron. One of the telltales is that oftentimes manganese will develop on the inner of the older leaves of the tree, where the iron chlorosis will develop out on the newer leaves. These are some of the hosts, and if you look at iron, the pin oak is at the top of the list, but also you'll see that silver maple is also included in that as well, and silver maples are also susceptible to manganese deficiencies. So oftentimes you don't know really which one to treat. Oftentimes arborists will treat a silver maple that is showing both symptoms. They will treat that with, with showing the symptoms, they'll treat them with the both products. So, for example, silver maples, you'll see both deficiencies on them. Usually out in the Midwest, you'll see red maples are suffering from manganese, and then iron deficiency, you'll see that pretty much all around the country. I know depending if the limestones, if the soils are potentially alkaline due to the limestone content into the soil. And as I mentioned, arborists will treat with both if they're not really sure. So a couple other problems that we have and that trees can have that are showing chlorosis is the soils are compacted. What happens when the soils are compacted? The pore space is reduced, the oxygen levels have dropped considerably, and so and the soil chemistry changes. Waterlogged soils are also a cause that can also exacerbate this problem. If the soils are not poorly drained, you're going to get some root rot problems, and then you're going to get limited uptake. Also, mite damage can also cause some of these symptoms as well, and also some of the vascular disease problems. Here's an example of what happens when the pH rises or lowers. For example, if we look at manganese and iron, as the pH rises, you'll notice that the availability of these two elements decreases. It's very difficult to change the soil pH. It takes a long time, and it's usually it's just not the best way to go about making those elements available. If you do suspect that you've got a chlorotic tree, you can take a sample and you can send these to the University of Minnesota Disease Clinic, and they will be able to diagnose it fairly easily. So we've got the management protocol, and this is how we, over the long term, what we want to do is get a healthy root system, and understanding the causes of chlorosis. How do we adjust it? How do we fix the site? And how do we actually do the injection of the material into the vascular system of the tree? So what we'll do is talk basically about how to do this. How do we do this? How do we deal with the root system? Very oftentimes, if the trees are, let's say, in an urban environment and they're located in a tree planting pit, Oftentimes the roots have never really developed properly. Oftentimes the tree has outgrown its own root system as well. During construction, you'll get soil compaction, roots will be cut, injured in some way, and so the result basically is the tree is not able to take up adequate amount of nutrients. Another thing, we want to eliminate competition, and this is a very classic slide that Gary Watson had devised at the Morton Arboretum. We want to eliminate competition, and one of the greatest competitors of tree roots are turf grass. And you can see in this illustration, the grass roots have been taken out. The only thing you see below this is just the tree roots. So they will compete because the grass roots are growing in that top, 8 to 12 inches of the soil, and they're directly competing with the tree roots. Where if you go in with mulch, you're reducing the competition, and the mulch is going to moderate the soil moisture levels, the soil temperatures, keep the weed growth down to a minimum, and also provide organic matter to that tree to help create some better growing environment. So what do we do? How do we provide this the soil loosening service? What we do is we want to decompact the soil, and what that's going to do, that's going to allow to get more oxygen into the soil, and also allow water to penetrate, and also gives you a chance to incorporate organic matter. And one of the best supplements would be composted cow manure. But talking about macro-infusion, this is the product that we recommend to inject. Verdur manganese and Verdur manganese and just straight Verdur, which is for iron chlorosis, are administered the same way. The ideal time using the high rate would be late summer, just before the development of fall color. If you have a client that's insistent that they want to get this tree improved immediately, you can go in at the low rate, and you can do that in the early spring, just as the buds are breaking. One of the drawbacks, though, to doing these two treatments is that during the springtime, if you use the high rate of this product, you can cause some phytotoxicity, and oftentimes all the foliage or most of the foliage will drop prematurely, resulting in a very unhappy client. So using the manganese, the high rate is 3 level teaspoons of this water-soluble manganese in a half a gallon of water, and that would be applied for every 10 inches of trunk diameter. So you do have to measure the diameter of the tree, and also you have to take in consideration that the crown of the tree is fairly representative of the diameter of the tree. If you notice that 50% of the crown is missing, you would have to adjust the dosage by 50% and reduce that. If you want to do this treatment in the early spring, you would use 1/3 of the high rate to prevent some of the phyto issues. Verdur is used at 1 packet for every 2 inches of DBH and a half a gallon of water for every 10 diameter inches. Again, this is also the reduced rate. In my experience, I would not recommend going in the spring and doing the low rate. You get your best results doing the high rate late in the growing season. So how do we do this? How do we inject this product? The most important thing to do is use the high helix drill bits. They will cut the vascular system, and they will allow more efficient uptake of the product. If you do spin that drill bit in the hole, you will burnish or cauterize those vessels, and that will slow the uptake. We set up this harness system with this plastic tee. It's just slightly tapped into the tree, and the product, it goes right into the xylem, and it's a very efficient way of doing it. Again, another thing you've got to do is a root collar on these trees, making sure that the tree does not have any severe girdling root issues. This would be a perfect candidate. These would be the ideal sites in blue where you would do the injection, and the lower you go, the better uptake you get and the better wound closure. What we do is we apply this material through a harness system, and so here's your reservoir that's pressurized to 15 to 20 pounds, and it's pressurized, and you get good equal pressure around the whole base of the tree. before you put the active ingredient in your system, in your tank, you want to make sure that you're using water only, and you want to check for leaks. Oftentimes you'll get air bubbles caught on these lines, so what you do is you've got the one you're going in at 9 o'clock and 3 o'clock, so at 12 o'clock and 6 o'clock you want to pull those T's out to allow the air to escape. You're going to have to do manganese treatment every 2 years, and then the same thing with Verdur, but you may get up to 3 years of green up with one application. I would definitely, come back and monitor that the next year, just to make sure that you're getting, you're getting the proper dosage. One thing, a little drawback to manganese, you're not going to see the color improvement not nearly as quickly as treating with iron, and it may take one full season to see the results of that treatment. Here's an example of an application made September of 2005, and coming back in June of the following year, you can see the results are pretty dramatic. And in kind of summarizing here right now, here's a small pin oak that was treated, and so you've got Verdur was used and Cambistat, and you can see just in 1 year the results are pretty dramatic. Just so you know, we have some upcoming webinars that that'll be over the next couple of weeks or so. And if you're interested in attending these webinars, please go to treecarescience.com events and register. These are the topics, these are the presenters, these are the dates. And in finalizing, I want to talk a little bit about a project that we have going on called Saluting Branches. The veterans, what we're trying to do is we're trying to salute the veterans. We're trying to provide a service for them and their loved ones. These military members have provided us our safety. They've protected us, and oftentimes they've given the ultimate sacrifice in terms of their life. And so what we're trying to do at Rainbow is we've been doing this for years in Minneapolis. We've been going out giving days of service. A lot of these veteran cemeteries, most of them are not properly maintained. Some of the high-profile ones like Arlington, of course, have professional tree companies come in year after year and provide pruning. But there's about 119 cemeteries around the country. We're trying to work at 22 of them, and what we're looking for is we're looking for volunteers for on September 23rd to volunteer their time and their effort and their equipment to go to these cemeteries and help clean them up and provide a nice, safe environment for their loved ones and family members to go to. These are the locations of where these cemeteries are going to be worked on. I'm going to be personally working at the Beverly National Cemetery in New Jersey. We're looking for site volunteers, for coordinators for a lot of these cemeteries. And so if you can go to salutingbranches.org to sign up as a volunteer, we would definitely appreciate it. And I'm out of time. I thank you for your time, and please feel free to call me, to contact me via email, and we can discuss any of your issues. And also at the same time, if you're not currently a Rainbow client, please feel free to contact us at our website, and we will get you in touch with the territory manager that services your territory. Thank you very much for attending, and have a good day.